I'm Michael Ransone. I'm a hip and knee specialist at EmergeOrtho. One thing that comes up often in a visit when patients come to me, once they've made the decision to move forward with a hip or knee replacement, is where do we do that hip or knee replacement? Historically, a lot of the norms were that was done in a hospital setting. If you go back 20 years, patients were staying 7 to 10 days in a hospital. And certainly we've been able to improve that length of stay, not just because we want to shorten the amount of time you're in the hospital, but because we want to shorten the amount of time that you're at risk. And what we know is for certain patients, the longer we stay in the hospital, the increased risk profile that patient can see. Certainly things like infection, things that we want to prevent. So for the right candidate, for a patient who has the right support at home, an outpatient surgery where you get your surgery or hip or knee replaced that day and you go home that day is a wonderful option. We've done a lot of research on this in the field of hip and knee arthroplasty, and we've been able to show that it is, for the right patient, just as safe or sometimes have even better outcomes. The interesting thing about pain control after a hip or knee replacement is that we give you the same medicines at home when you go home that day that you would have access to at the hospital. So I think that sometimes, that understanding that they're going to have the same medicines, the same access to the same pain control modalities, really makes patients feel more comfortable. And again, I think the most important thing is that feeling comfortable where you're getting your surgery is the most important part.